How does cryotherapy treat cervical cancer? Have you ever wondered how certain treatments can help prevent cancer before it even starts? Cryotherapy is one such method, particularly for cervical cancer. This treatment focuses on freezing and destroying abnormal or precancerous cells on the cervix. These cells can develop due to cervical dysplasia, a condition that, if left untreated, may progress to cervical cancer. During cryotherapy, extreme cold is applied to the affected cervical tissue. This is typically done using liquid nitrogen or compressed gases like carbon dioxide or nitrous oxide. The cryoprobe lowers the temperature of the tissue to around degrees Celsius to -90 degrees Celsius. This intense cold effectively freezes the abnormal cells, causing them to die. As the body heals, these dead cells are replaced by healthy tissue. Cryotherapy is particularly effective for cervical intraepithelial neoplasia, known as CIN. CIN is graded from 1 to 3 based on how severe the lesions are. For lower-grade lesions, like CIN 1 and 2, cryotherapy has a cure rate of about 90%. Even for higher-grade lesions, such as CIN 3, the treatment still shows significant effectiveness. One of the advantages of cryotherapy is that it is less invasive than surgical options. It can often be performed in outpatient settings without the need for general anesthesia. The typical procedure involves a cycle of freezing for about 3 minutes, followed by a 1-minute thaw, and then freezing again for another 3 minutes. This method not only destroys the abnormal cells but may also help stimulate the local immune response, which is crucial for clearing human papillomavirus infections. Human papillomavirus is the primary cause of cervical dysplasia and cancer. Cryotherapy is considered safe and cost-effective. Most patients experience minimal side effects and can return to their normal activities within a couple of days. This treatment is especially beneficial in low-resource settings, where access to more complex treatments may be limited. Before undergoing cryotherapy, healthcare professionals usually perform a colposcopy and biopsy to confirm the presence and extent of abnormal cells. Follow-up care is essential to ensure that the lesion has been fully treated and to monitor for any recurrence. In summary, cryotherapy treats cervical cancer by freezing and destroying precancerous cells, effectively preventing the progression to invasive cancer. It is a minimally invasive, effective, and accessible option that aligns with current medical guidelines for managing cervical dysplasia and early cervical cancer. Always consult with a healthcare professional to discuss the best treatment options for your individual situation.